very lucky to have the one and only Steve Birrell, Associate Professor Steve Birrell, would that be fair?
Professor Birrell.
Professor Birrell. You're not associate with anyone anymore? No, I'm just teasing. And we're going to be talking today about something that's very important. Something because, you know, we've known each other for many years, and my work in natural medicines, working particularly with people with cancer, we've come across particularly dealing with breast cancer and the importance, and also something else I know you're very interested in, menopause and perimenopause, the whole situation, because there's a direct link there. So, and you've got some exciting things and exciting developments. So, tell us about it, please.
Well, Phil, for many years I've been researching the hormonal origins of breast cancer, and as a result of that I've discovered that one of the most critical hormones in a woman's transition into menopause is testosterone.
And that's relatively new, isn't it?
Well,
Because it was very controversial once they could think of it, wasn't it?
Well, the reason that it's controversial is that testosterone has always been thought as a man's hormone.
Yes.
You know, if you have testosterone, you look like me, bald and hairy.
Yes.
But that's not the case. Women actually have 6 times as much testosterone as they have estrogen. And so it's a very important hormone in the female body. And it's the ratio of testosterone to estrogen that's critically important right through a man and a woman's life. And
So the progesterone and estrogen balance,
yes,
which has always been the thing that's been sort of looked at and worked upon, is that showing not to be quite so relevant?
well, no, look, progesterone really is the hormone of conception. It really only is an important hormone during a woman's reproductive life. It's not as important as women go through menopause and into older age.
Right.
And that has been a fallacy that they're the 2 important female hormones.
Yes.
It's not the case.
Yes.
It is estrogen, or more specifically estradiol, and testosterone in ratio.
Right.
And so the advent of this realization that testosterone is important has led to myself and quite a few other researchers, predominantly in Australia, interestingly. The Jean Hales Foundation in Melbourne has done a huge amount of work on testosterone in women. That it is the critical hormone for taking a woman into menopause. When their estrogen drops off, it is the hormone which is required to take a woman into old age.
Yes.
Predominantly because testosterone can be converted into estrogen or into activated testosterone.
Right.
And so it has that ability to maintain a balance even in menopause. However, in the perimenopause, that's when problems arise. And I think that there are 2 important issues here. One is that the way women go through menopause now is probably not the way it's been thousands of years ago. This is a modern industrial world phenomenon where women have got huge levels of estrogen, which leads to early onset of periods, leads to late onset of menopause, and leads to a problem, especially in the perimenopause. And the perimenopause is not just that time when women get hot flushes and their periods stop.
Yes.
It can start in the 30s
Yes.
and go right through into the 60s.
Yeah, bumpy journey.
And you get these high fluctuations in estrogen, which can lead to energy problems and mood swings, joint pains, the fluid retention that can occur. And it's a really difficult problem because traditionally there hasn't been a great way of dealing with that perimenopause period. A lot of GPs use the pill to regulate out the hormones, but the dilemma with that is that there's increasing evidence that oral contraceptives and traditional hormone replacement therapy has a significant deleterious health effect.
Yes.
And you see, logically, if you think about it, just taking traditional hormone replacement therapy, which is estrogen and progesterone or progestin, the reason the progestin was added to stop women getting cancer of the uterus. That's the only reason it was added, and that led to huge problems with bone, cognitive function, and breast cancer. And we now know unequivocally combination HRT increases the risk of population-based breast cancer statistics by 25%.
That's huge.
It's huge. It's a huge. But if you think about it, if a woman is meant to go through menopause, which the human female is the only mammal apart from a chimpanzee in captivity that has menopause, but female humans are a very sophisticated evolutionary being. They actually are designed to go through menopause. If that's the case and the estrogens dropped off, why perpetuate hyperestrogenization?
Because you're going against nature.
You're going against nature.
What's supposed to be the
And
curve.
so the strategy was that evolved from the work that I've done and the work that I'm currently doing with the Mayo Clinic in America is to look at enhancing a woman's testosterone during those critical times of transition into menopause. It flattens down the big, because testosterone is like a natural anti-estrogen. In the breast, for example, which is an organ that I know very well, estrogen increases breast density. Testosterone reduces breast density, which is the critical factor in determining whether a woman gets breast cancer. We now know the denser a woman's breast, the greater the risk of getting breast cancer.
Is it beneficial to the bones? I mean, because we often think about looking to prevent osteoporosis, and that's another reason that sort of estrogen was looked at, and that was supposed to be one of the benefits. How does testosterone?
Well, it's absolutely critical. You see, testosterone is what is known as an anabolic hormone. Now, anabolic makes people start thinking about Arnold Schwarzenegger and steroid abuse, but anabolic there's anabolic and catabolic, and the body's in this balance of breaking down and building up. And testosterone only builds up. It builds up bone, it builds up muscle, and it is why men who've got 10 to 100 times more testosterone than women are bigger and stronger and got denser bones and more muscle. But in women, they need that testosterone because when their estrogen's gone, which is protecting the bones, if their testosterone level isn't high enough, they have nothing to protect the anabolic process, and it's only catabolic, breaking down. And so the concept that we came up with for specifically breast cancer patients was to actually use testosterone in combination, natural testosterone. When I say natural, people say, well, how can it be natural if it's man-made? You can make man-made identical testosterone to what's in your body.
Yes.
So it's identical testosterone combined with a small amount of a pharmacological manipulation of the testosterone that stops it being converted into estrogen.
Right.
So it's made into a pellet which is individually made to the person's hormone levels and immunological status, because there's an intimate relationship between immunological function and hormones.
And that's orally taken?
It's to put in as a pellet for 6 months.
Right, right, so under the skin.
Under the skin.
Yeah.
And so when it goes into the fat, because of this pharmacological enhancer, it doesn't get converted into estrogen in the fat, which is very important.
Yes.
And it gets absorbed into the body to give a constant stream of testosterone into the bloodstream. And what it does is it definitely reduces breast density. Now, the reason we know this is that in women who have got polycystic ovarian syndrome, a very common syndrome, they have very low risk of getting breast cancer. And one of the things they have is a pathologically high testosterone level, and their breast tissue is not dense. And so when you do a mammogram on a PCOS or polycystic ovarian syndrome woman, her breast is what's called fat replaced. We know those breasts are at very low risk of getting cancer. And so it reduces breast density, enhances bone disease, but probably one of the most important things, and after doing 25 years of perimenopausal health, what I hear is I'm like walking through a thick fog.
Yes.
It's my legs are dragging through mud.
Yes.
I forgot to pick up the kids from school.
Yes.
You know, all sorts of relationship breakdowns.
Depression,
And
mild anxiety, all that.
And well, libido also.
Yes.
And libido is a multifaceted
Yes.
thing. People think testosterone, they're going to become very amorous, but libido is a multifaceted thing. It's not just a one hormone function.
So this new clinic that
Yes.
you're doing, that specialises in that. So the woman can come in and all the tests are done, everything, and it's tailor-made to her metabolism.
Absolutely. And what it is that we're trying to actually reclaim the concept holistic care
Yes.
for a woman in that, because we understand that time of a woman's life extremely well. And it's two basic fundamental things we're doing is looking after hormonal balance
Yes.
and looking after breast health.
Yes.
Because that's
That combination is
and those combination, because breast cancer is the #1 killer of women in that age group.
Yes. Yes.
And this hormone imbalance is the most major. That's why so many women are on antidepressants.
Yes.
You know, in that age group, and there's so many problems. And these are women who are at the peak of their
And it
careers.
seems so easy if we can fix that and make that easier, and then we're helping all the way down the line.
Well, you know, my philosophy, I guess it's because I've done women's health for such a long time, is that if you get the women healthy, the world's a much better place.
For sure, and so is the home as well.
Absolutely.
Without doubt. Women will need a referral from their doctor?
Look, the way it's currently structured is they don't necessarily. What I'm training up general practitioners who are specialist women's health nurses, women's health doctors, to actually run the clinic with my supervision. And so when that's the case, they won't need a referral. But if they specifically need to see me, they do need a referral.
Can they find out more? Is there a website?
There's a website, and can you run this across your...
Yeah, tell us now, we'll put it on the...
Well, it's www.wellendhealth, wellendhealth.com.
We'll put that on. Well, that's absolutely fantastic news. I think it's great. So let's keep in touch about that.
Good on you, Phil.
Thank you.